Hello, everyone. My name is Robert Bednars, and I am a junior doctor in Dundee, Scotland, and you're listening to the Patient Will See You Now podcast. I have to say, this podcast is for educational use only, and you should not be using this as medical advice or opinion. Please go see your doctor if you have any medical questions. This podcast is supposed to be fun and educational. So now that I got that out of the way, let's get into this week's topic. So, on this week's episode, we're going to be talking about the human immunodeficiency virus, better known as HIV. And HIV, what is it? HIV is a virus that targets cells in the immune system. And there are two types. You have HIV-1 and you have HIV-2. HIV-1 is the one that's more common in the US and worldwide, whereas HIV-2 is just found in Western Africa and Southern Asia. But it's So, on this week's episode, we're going to be talking about the human immunodeficiency virus, better known as HIV. And HIV, what is it? HIV is a virus that targets cells in the immune system. And there are two types. You have HIV-1 and you have HIV-2. HIV-1 is the one that's more common in the US and worldwide, whereas HIV-2 is just found in Western Africa and Southern Asia. But it's just HIV-2 is just so uncommon that when we talk about HIV, we usually are just talking about HIV-1. And if not controlled properly, the HIV infection can lead to a disease called AIDS. So a little history. At first, when there really wasn't a name for the disease yet in 1966, it was just called lymphadenopathy, which literally means a disease in the lymph nodes. Later, the press coined the term GRID, GRID, which stood for gay-related immune deficiency, since at the time it was thought that only the gay community was only able to get the disease. After that, the CDC called it the 4-H disease, as it seemed to only single out homosexuals, heroin users, hemophiliacs, and Haitians. After many years later, when scientists and people have realized that this disease can affect absolutely anyone, the CDC finally gave it a name after 16 years in 1982 and called it AIDS, or acquired immunodeficiency syndrome. So, just a few facts before we get into the interview. Some of the people who are higher at risk are men who have sex with men. It doesn't mean that they're gay, because there could be men in heterosexual relationships that just happen to have sex with other men. Also, people who are at higher risk are IV drug abusers, blood transfusion recipients before 1985, because that's when we started screening for donor blood before giving it. Heterosexual contacts of individuals who are HIV positive, and unborn and newborn babies of mothers who are HIV positive. So now, the transmission risk. When you so for healthcare professionals, they might get a needle stick injury. So maybe a needle went through somebody who is HIV positive, and then the medical professional might get stabbed by the needle afterwards, and there is a 1 in 300 chance of that person getting infected. Now, when we're talking about heterosexual relationships, it's actually difference. If there's a difference if it's the guy who has HIV and the female doesn't, and if the female has HIV and the guy doesn't. Now, if it's the male who's positive, he can give it to the female more easily than if the female had it to the male. So the statistics are a male that has HIV positive having sex with a female, there's a 1 in 1,000 chance for the female to get it. Whereas if the female has it, then there's a 1 in 3,000 chance that the guy can have it. So it's just because of anatomy, which is why when there's anal sex involved, there's a 1 in 100 chance of getting it because of the breakage of tissue is much easier. So just the anatomy, it's just much easier for a male to give it to a female than it would be for a female to give it to a male. Now, in terms of mother to child, there's a 1 in 3 chance without medications, and under 2 in 100 with medications. And we have to be careful because HIV can be transmitted by breast milk. So in this sense, I tried to explain the pathogenesis. You can try to leave a comment if you think this was something that you used, if you liked it, or if you didn't, just let me know. But I'm going to try to make these a little bit more fun so that everybody can understand. I try to make it so you don't need some kind of medical degree or science degree background to understand. So, the HIV virus attaches to immune cells that have a CD4 marker on them. And all that means is that some cells have certain markers on them to help other cells identify them. And in this case, to kill pathogens and bacteria and viruses. HIV, however, looks for those cells that have that CD4 marker on them. For example, like macrophages, dendritic cells, and T helper cells, which are just cells in your immune system. And the HIV virus attaches itself onto these cells. And then there's also a co-receptor attached to the CD4. I'm already maybe a little confusing, but let me try to make a visual for you. So HIV is this 3D spherical shape that has an outer shell, and the virus itself is inside of it. But let's make it 2D and imagine a Ferris wheel, like the ones at carnivals and festivals and such. Let's say that the Ferris wheel detached from its core attachment is now rolling down the street wild. Scary, right? Just like the HIV virus. Anyway, you got this Ferris wheel rolling down the street, but it's actually looking for something to attach to. Each carriage on the Ferris wheel represents a protein on the virus called GP120. Now, one of those carriages stick to a cell that has CD4 marker that I was talking about earlier. And for the virus to successfully get inside these immune cells with the CD4 marker on them, it needs to have this second attachment. So another carriage on the Ferris wheel needs to roll just a bit more to attach to a co-receptor that's attached to the CD4 marker. Some people are lucky and they have a mutation in this co-receptor, hence are actually immune to the HIV virus. But most people aren't. And when this double attachment happens, so that two carriages of the Ferris wheel attaches to the cell, the virus that was inside can finally get inside the immune cell and then integrates with the immune cell's DNA. And then when the immune cells get activated by means of an infection, it will not only activate to kill off the infection, but it will also be replicating more of the HIV virus. So HIV is really tricky virus in that way. Um, and with this happening, immune cells are being destroyed, which makes people who are HIV happening. Immune cells are being destroyed, which makes people who are HIV positive more prone to infections that otherwise healthy people wouldn't normally get. So some signs and symptoms. The course of HIV infection varies from person to person. However, in most cases, you can divide it into 4 distinct phases. And you have the primary infection, the asymptomatic infection, the symptomatic infection, and then full-blown AIDS. And the reason it's that way is because of this. Once infected, you'll first have an immediate rise of the virus inside your body and a decrease in the immune cells to fight it off, because it's kind of as if it's at war. And for this battle, your immune system is strong enough to first fight it off in the beginning so that the amount of the viruses go down immediately and the immune cells kind of get back to its normal amount. Did you get that? So its immune cells die, but then the viruses go down, the immune cells have some time to recuperate. And this kind of causes like as if you had mono or like flu-like symptoms for about 2 weeks after being exposed. And that can last anywhere from 3 days to 2 weeks, just like the flu. And just like the flu, the symptoms are fever, sweats, being lethargic, some malaise, headaches, muscle aches, diarrhea, sore throat, enlarged lymph nodes, and also like a rash on your body. And it's at this phase that the person is actually particularly infectious. But then the virus is hiding for a very long time and it slowly replicates and more of it creeps up on the body, assassinating immune cells left and right without the body noticing it right away. And that's what we call the asymptomatic phase or no symptoms. And it lasts anywhere from 4 to 7 years. And during this time, the amount of the virus goes up and the amount of the immune cells go down, causing symptoms to come back. And this is the first evidence of immune system dysfunction. And without treatment, it can last for about 1 to 3 years. Symptoms in this phase, the symptomatic phase, can include a persistent generalized lymphadenopathy, so that disease of the lymph nodes that I was talking about, where your lymph nodes, usually in your neck, can get pretty enlarged. Localized fungal infection, like on the toes, fingernails, or mouth, a vaginal yeast and trichomonal infection, an oral hairy leukoplakia on the tongue, where your tongue gets really white, some skin manifestations, and also some constitutional symptoms like night sweats, weight loss, and diarrhea. After all of that, and if the infection isn't being managed with the proper therapy, the immune cells will drop even lower, to the point where the individual now has full-blown AIDS and is more prone to opportunistic infections that a healthy person would normally be able to fight off against. And these are pretty nasty. Just some of them are, there's one big one that's PCP, not the drug. This one's called pneumocystis pneumonia, which is a pretty crappy pneumonia to get. Kaposi sarcoma, progressive multifocal leukoencephalopathy, wasting syndrome, tuberculosis, and cervical cancer, just to name a few. If any of these occur in an individual, these are called AIDS-defining illnesses, and we can diagnose a patient with AIDS if they are HIV positive and have any of those mentioned infections above occurring with it. Individuals with AIDS usually die because of these infections, in which a healthy person would normally be able to fight off these infections. So now, diagnosing HIV 1 or 2, we get the HIV 1-2 antibody antigen immunoassay, which is just a blood test. And if this comes back positive, we do a second test just to confirm it. Technology got so advanced now that there are even simple finger pricks that you can do at certain clinics or pharmacies, and the results come back immediately with a 99.6% accuracy. The definition of a diagnosis of someone with AIDS is at least one of the three: a CD4 cell count of less than 200, a CD4 T cell percentage of total lymphocytes less than 14%, or having one of those AIDS-defining illnesses that I mentioned above. Now, when it comes to treatment, unfortunately, there's no cure for AIDS. However, treatment therapies we have today will help someone with HIV/AIDS to live longer, healthier lives and be able to reduce the risk of transmission, even to the point where it can be completely safe to have sex with your partner again. Explain that you have HIV, but it's undetectable, meaning it's untransmittable. The therapy we use is called highly active antiretroviral therapy, HAART for short, HAART. And it's a combination of medications which we call a HIV regimen. It slows down HIV replication, which gives the immune system a better chance of recovering and fighting off other infections. The goal with this medication is to reduce the amount of the virus to undetectable levels, but not completely. The other part of the treatment is just to prevent the infections that these people can get. So we screen for diseases like tuberculosis or give antibiotics once the CD4 count is at a certain level. And it's also very important to give vaccines, but not the live ones. So recommended ones for someone with HIV are the pneumococcal polysaccharide vaccine, which is also known as Pneumovax. The flu shot, totally fine. Everyone can get the flu shot. The hepatitis B, if the individual is not antibody positive. So without further ado, let's get to the interview, and I hope you enjoy it.
Can you hear me?
Hello? Yeah, I can hear you. Can you hear me?
Hi. Yes, I can hear you. Yeah.
Great.
How are you doing?
So this is Robert from the Patient Will See You Now podcast. How are you?
I'm doing great. Thanks for holding off on my call. I just wanted to get that workout done. Appreciate it.
No worries here. So I was thinking we could just go straight into it. Is that all right with you?
Of course. Yeah.
Perfect. So
Yeah. Okay, go.
So maybe just introduce yourself, and if you can just tell us what you have and how did it all start. When did you notice that something was different? Just take it from the beginning, and we'll go from there.
Okay. Okay, good. Yeah.
Did you notice that something was different? Just take it from the beginning, and we'll go from there.
Okay. Okay, good. Yeah, and feel free to interrupt me anytime. So my name is Jennifer Vaughn. I'm 49 years old. I'm a mother of three. I have a 19-year-old, a 16-year-old, and 12-year-old. And let's see, I'm a substitute teacher, and I live in California. And I've been a single mom since 2008. And in 2016, I started getting really sick. Honestly, I was noticing symptoms only about maybe 2.5 months prior to my diagnosis. So I was diagnosed with HIV, and but up until then, I started just getting really sick, flu-like symptoms, incredibly tired, just having trouble just functioning every day, getting through my regular day of work, and just taking care of my kids. And I was starting to. I went to the doctor about 3 weeks before my diagnosis and just said, I'm just, not sure what it is. And they just said, it's viral. It sounds like just, take Advil and you'll probably be fine. And as those next 3 weeks progressed, the symptoms just continued to get worse. And I was getting more tired. I couldn't eat. I just had no appetite. I was feeling kind of like nauseated all the time. Not vomiting, just didn't feel like good at all. And, constantly trying to just get home after work just to get into the bathtub because everything ached. I remember thinking I needed a new mattress possibly because my hip joints were hurting so bad during the night. I'd have to flip over constantly. And I didn't, I thought, gosh, I'm like, my mattress must be really old because my hips are just killing me. And then finally I started getting fevers. And then I was like, okay, something's wrong. Like I'm just getting sicker. Like this should be getting better by now. And so they finally did some blood work, and it came back abnormal was really all it was. The white blood cells and red blood cells were off. I had blood work, and it came back abnormal was really all it was. The white blood cells and red blood cells were off. I was looking almost diabetic. And so I was like, wow, it was scary. I was like thinking lupus, cancer, meningitis. There was a lot of things I was concerned about. And then finally, the day before I got my diagnosis, I was at that point having fevers for like probably 4 nights in a row, and then night sweats. I was getting all the classic symptoms of HIV. Had no idea though. I was feeling like, because I surf, I had a feeling, I'm like, I swallowed something in the ocean and it's a parasite. It's like, I can feel it all over my body. It's affecting my whole body. It must be a parasite. So I go in with that, thought, telling them exactly that. And they said, they sent me to a specialist because this one doctor, I was going to something called Doctors on Duty here in California. And it's basically they call it like a doctor in the box. You don't really know who you're going to see when you go in. And so I kind of saw different doctors every time I'd gone in, and nobody had really added anything up. So they sent me to an internal medicine doctor, and he finally, that same day, they got me over there right away, and they said, you need to be seen by somebody more experienced. And so he said, we're going to test you for everything. And he asked me during that appointment, and he was concerned for meningitis. He said, if you start feeling like you're not sure of something and you feel confused, go to the hospital right away, because if this is meningitis, we don't want to mess with that. That's your brain. And he knew I'd been having fevers. And so HIV wasn't on my radar at all. And he asked me during that appointment, can we test you? They have to ask, can we test you for HIV? And of course I said yes, but it didn't even, nothing registered in my brain for HIV. I was positive it was this, parasite. And so they did actually draw a bunch of blood to put it in those, I can't remember where they just would sit for 3 or 4 days to see if there is a parasite. So I remember put those on. I'm like, that day I expected to wait 2 to 3 days to hear something. I didn't think I'd hear anything. And about 3 hours later, the phone call came in from that doctor, and he said, we do have a result, and you tested positive for the HIV antibody. And I just remember thinking, I was sitting there in my living room. My boyfriend of 1 year was sitting across from me, and my mouth just dropped. I just remember thinking, really honestly, I felt like I'm a mother of 3, and I can't even explain how bad I felt. I'm like, my whole life is going to be over. This is it. It's done. I'm the worst person ever. Everything just went through my head, and everything was black. It was just, how did this happen? What happened? What? It's like, this has been in my body for how long? How did it even get into me? But I felt certain that in that moment, it registered that it must be that, because once we sat there and looked up all the symptoms after we got off the phone with the doctor, my daughter was there too. She was 15 HIV. It was like all the symptoms that I was having. And then it just immediately you go to exactly like, how did this happen? Like, who did this come from? How long has it been in my body? Oh my gosh. Like, am I going to die? Am I going to be able to raise my kids? Did I give it to my boyfriend? Did he give it to me? All of these things. So I have to go through that night without any kind of like counseling at all. We did everything on the internet. And at that point, I didn't know at the time, but my CD4 count was under 200, which is considered an AIDS basically category. And anything below 200 means that your immune system is severely compromised and you're very susceptible to opportunistic infections. And I didn't know that at the time. I just knew I was sick with HIV. And so I was in the very beginning stages of getting pneumonia and didn't know it. And so within 2 to 3 days, I started having this cough. And then I was diagnosed with pneumonia, about a week, beginning stages of getting pneumonia and didn't know it. And so within 2 to 3 days, I started having this cough. And then I was diagnosed with pneumonia, about a week later. And then, of course, I was diagnosed with AIDS, basically, because everything was just kind of a mess. So at first it was the HIV diagnosis, and then about 5 to 6 days later, it's like, you also have AIDS. It was like, oh my God, what else, So my boyfriend tested the next day, and everybody always says it was miraculous, but it's really not. It's very uncommon for females to transmit HIV to men just because of the anatomy. He was negative, and we'd been together for a year, unprotected sex, and he was completely exposed to me with a very high viral load. It's not that it can't happen, but it isn't very common. So the next thing in my mind was just to try to figure out how to get better and where it came from, because I was determined to find out. And I'd say after my diagnosis that night, it took me about 30 minutes to think in my mind who it could have been. I've seen for 8 years, and I dated for sure. And I kept thinking of who might have been high risk. And high risk is basically a man who is more than likely had sex with another man, or a man who has used needles for drugs. And I did date somebody who had used needles, and he thought he was clean. And I basically was able to track him down through Facebook, and because we didn't have a connection anymore, and I found him through like his cousin and stuff, found out he'd been very sick. People thought in his family that he had cancer. And then they realized nobody knew in his family. It all kind of came out because I contacted the family. But it was him. So he had tested positive 3 months after we broke up, and he never contacted me because he gave, people give him a lot of a bad time about it, because I have a YouTube channel about my diagnosis, and I've talked about how this all went down, and he had given my name and number to the clinic, which is fine. That's what a lot of people do, and they have clinics call people who have been with their past partners, which is totally like you've been exposed to HIV. So he didn't call me, and he left it to the clinic. Somehow they didn't contact me. I don't know how. And so I never got the call. So I basically had it only for 2.5 years. But it was because I tested for HIV in 2011. It was negative. So I know for sure it happened in 2013. So I had it for about 2.5 years, and it just progressed quickly to AIDS. I don't know why. Could have been just stress in my life, working, having, raising 3 kids. I'm not sure. But so that's, so I don't know how much you want me to keep going on. I could talk forever about it.
That was already a lot. That was great. And you explained so many things that I'm going to mention in the beginning part of the podcast of this episode, how you're right, exactly, how it's not common for a female to give it to a male. It's usually the other way because of the anatomy. The people who are most at risk, like you said, are just men who have sex with men, and IV drug users. Exactly what you said.
Correct.
So
correct.
I have a few questions, and what was surprising to me was your CD4 count was less than 200, and that is one of the ways we diagnose somebody with AIDS. And you were saying how you got pneumonia and you were getting sick. And that's miraculous that they were able to catch you at a certain time. And I'm guessing they gave you the therapy you needed and also got rid of the pneumonia. And now, where are you now, would you say? Do you know your CD4 count? Or?
Yeah, my CD4 count's around 500, around there. It took a while for it to get back up to a normal range. Normal range is anywhere between 500 and like 1,200. But when you get down really low, under 200, under 100, it takes longer for it to recuperate. And so it took longer. I have to say, once I recovered from pneumonia, which just is like, a lot of antibiotics for about, 3-4 weeks, I felt fine. So once my pneumonia was clear, I felt normal again. And even though my CD4 count was still under 200, I felt totally fine. And I know a lot of people who have had AIDS who have been down into the under 10 with their CD4 count, and they're living a normal life under 100. They have to continue to take like prophylactically antibiotics just to make sure they don't get anything, but they feel fine. So it was really just a matter of getting that medication in me every day and making sure I took it religiously, which was fine. I wanted to get better. Obviously, I needed to go back to work. I needed to vacuum my house. I was like on my couch for 5 weeks. It was really hard. I'm a really anally retentive person, and I had to lay there and couldn't do anything. My mom had to help me. I mean, just getting to the bathroom was exhausting. And so, unfortunately, the pneumonia could have been fixed sooner. But what happened was there was a glitch in my insurance. So by the time they realized I had pneumonia, I needed something. And when I went to the pharmacy that night to get that medication, they not only didn't have it, it would have cost like $1,800 out of my pocket to get it. And so when I was diagnosed, my doctor said, you either have there's the more common pneumonia with HIV is called PCP pneumonia. And that's, more than likely that's what I had. They didn't culture for it. They'd have to go down into my lungs and like take a sample. So she just said, what we're going to do, because that medication's so expensive, is we're just going to treat you for community acquired CAP pneumonia, which is like the more common pneumonia that like older people get. So she said, we're going to treat you for that. So the antibiotic that I actually got wasn't working. So I went through the entire weekend without it wasn't her fault, but we just couldn't get it. So I was taking an antibiotic that really wasn't doing anything for the pneumonia, and it was continually getting worse all weekend. So I got to a point where I actually called 911 from my couch one night, and it was continually getting worse all weekend. So I got to a point where I actually called 911 from my couch one night. My parents were asleep. They were exhausted. They'd been here a couple of days. Had barely slept. My kids were all asleep, and I was laying on my couch. I was certain I was going to die. I could barely breathe. I had a fever that just kept spiking. I could barely even reach for my damn cell phone just to like call 911. So they showed up at the door. Of course, everybody in the house woke up, and the most like a humiliating experience ever to have 5 firefighters standing there in my really nice home and having to tell them I have HIV and AIDS. I mean, I'm a mother. This is like so humiliating, wondering what they must think of this woman sitting here on her couch. I mean, it really was a horrible, reflective moment. I just remember feeling so embarrassed in that moment, but I needed help. And I felt like I'm not sure I'm going to make it through the night. I'm afraid to go to sleep because when you have a fever like that, your heart is working overtime. And so your heartbeat is like at a constant would be, but it wasn't at my normal around 60. It was flying off the charts. And so my heart's just beating super fast. And I just was incredibly sick. And so I made it through till Monday, and the visiting nurse that would come through the county to visit me, she couldn't get into her office until Monday afternoon in Santa Cruz. And so what she did is she had that medication in her office from a non-compliant patient. She ripped the name off the label and drove it down to me about 20 minutes from her office and got that medication to me. And that is what freaking saved my life. And I got that horribly tasting medicine. It's like yellow paint. I couldn't wait for the next dose because I knew it felt like it was working. And I'm like, I mean, it was very scary. Like I literally went probably 4 or 5 days with really horrible pneumonia without the correct medication. So I finally got it. And from that day forward, little by little, I was getting better. And it was like, when you're diagnosed and you're sick like that, you think this is it. I'm going to be a super sick person. And I did. I'm going to be a super sick person. And I deserve it because I have HIV. I must have done something wrong because who else gets HIV? This is like so uncommon. I don't know anybody else in my life who has it. So I clearly totally messed up because I have it. These are all the thoughts you have in the beginning. I'm dirty. I'm it's deserved it. And now I deserve to be sick because I did something wrong. And so I was always feeling like that should have been the way it was. And then I start getting better. And I'm like, every day I'm better and better. And all of a sudden I'm feeling normal. And I'm like, I'm normal. Like I get to be normal. And so I'm taking my HIV medication. The side effects were totally tolerable. And I'm thinking, and then I get the news, of course you're going to live a normal life. She tells me about this man who's 80 years old who has HIV, who snowboards. I still have that visual in my head of this man snowboarding, 80 years old. And I'm thinking, okay, cool, I can do this. And I remember somebody from high school, because I did eventually put it on my Facebook, writing in and saying, we're thinking, these are my beginning, like, this is how HIV is. Oh, I'll get to work out. Cool. I'm like, it's just so crazy looking back that how nobody was really very, very educated on it. The people that I knew who were trying to give me encouragement, but now I know what it is. And I'm like, oh my God, I'm the same I was before. I'm exactly the same. I feel no different because I'm undetectable. So it's not affecting me.
God, Jennifer, if you could just see the smile that I have on my face right now, it's amazing.
Mm.
It's so cool to hear that you
great.
can do all these things now. That it is possible for somebody that's HIV infected, that it is possible to live just a normal life, as long as you're on top of your therapy, on top of your management, and everything like that. I think it's even in the same category as diabetes, like type 1 diabetes. It's just manageable. It's not life threatening anymore as it used to be. How long do you think it took you to get to that point where you were just like, I can from the beginning of when you were diagnosed with HIV? I'm sure that was just really just a terrible moment for you and just horrifying for you. And it just, how long do you think it took for you to get to that moment where you're like, oh, actually, everything's going to be okay?
Yeah. Well, first of all, they do call it a chronic manageable condition today. And I remember seeing those letters printed on something, and I was like, it is. Like, that's what it is. But that was later on. I'd say probably as my symptoms decreased and I was starting to feel more myself, I'd say within of course, my doctor's appointment one week after the fact, she told me that this is going to be a distant memory and you are going to live a normal life. And I remember in that moment, I came in, I was green as ever. I just could barely even walk. And I was like thinking, okay, you're the doctor. I'm going to hold you to this, I hope. But right now I feel like I should be dying. Like I'm on my deathbed, And so I'd say I had that, tucked in the back of my pocket. But as I was getting better, I'd say within 3 weeks, when I was really getting moments of clarity and wow, I feel normal right now. Like I don't even feel anything. I can't believe it. Those were the times that I was like, this is and I never did keep it a secret. I was very open about it from the second I got the diagnosis. I told my family immediately. I didn't hold back it. And everybody I talked to from that point forward, I don't know. I just couldn't. It was absurd to me. I couldn't even believe I had HIV. I was like, you're not going to believe this. I have AIDS. Can you believe this? And so it was part of me just kind of told people along the way. And so as I was sharing with people, and then I was feeling more normal, I'd say about 3 weeks in, I was like, wow, I really am going to be okay. I'm going to live a normal life. And then my doctor recently told me after I hit a CD4 of 500, she said, I have really great news to tell you that people living really am going to be okay. I'm going to live a normal life. And then my doctor recently told me after I hit a CD4 of 500, she said, I have really great news to tell you that people have been studies done that people living with HIV, once they reach a CD4 of 500, that is where basically you're in that area of now you live a normal life like anybody else without any complications. And, really, a lot of us like to think that we're in better shape than most people that don't have HIV because we are continually checking our blood every 3 months. I never would do that if I didn't have HIV. So I get to know what's going on in my body at all times. And I'm really, honestly, I love that. I love being able to monitor my blood every 3 months and see what's happening. There's never any surprises. Everything's the same, but it's just nice to know if there was, I would be on top of it. So yeah.
that was actually going to be my next question. It was going to be the bigger changes in your life, that there won't be any bigger changes because you can live a pretty comfortable life. There's something on the personal standpoint and not the medical standpoint. If there are any big changes in terms of maybe relationships or family or friends or at work, was there any change there? Or even when your boyfriend found out that you were HIV positive, was what did he think? Can we talk about that?
Well, right. So I just have to say, first off, I am incredibly, incredibly fortunate that everything fell the way it did for me to be public about it. And that was because I had family support. They were all supportive of what happened to me. I didn't have anybody turn their back on me and say, well, you must have deserved this. And, and this does happen to people who are diagnosed, and they get that response and reaction from family and friends, unfortunately. And I know people that are, when they go to their in-laws, they have to use separate plates and utensils because the family doesn't understand that there's zero risk of anybody, contracting it from them. But thankfully I had incredible support. My boyfriend went and tested the next morning. He was negative, and his thought process was, and of course in that moment, I'm so sick. I can't even envision, like, if he decided he didn't want to be with me. I was in the back of my head, and I thought, I can't even think of that right now. I just got to get better. I was hoping, obviously, but I didn't even want to ask him. I didn't want to say, what's your plan? I didn't want to beg. I didn't want to cry about it. So I didn't say anything. And, we are, Eric and I are a long distance couple right now. We've been together for 5 years. And at that time, we've been together for 1 year. He's in Quebec. And so he spends his winters with me. And so he had already been here for 2 months for that winter, living in my house with me. And he was here for another month. So it was a really, it was a hard time. My mom came down. She's trying to take care of me. He's trying to not be in the way. He wants to probably sit and have his emotions and think about all of this. Like, how do I want to handle this? It's scary. It's so scary. You've been exposed to somebody with HIV. You're negative, but it's going to be like, she's clearly already kind of been public about it because she's talked to people about it. It's going to be, and honestly, he really does prefer that I speak about it. He was happy that I did that. He didn't want it to be the secret because it's out. And he goes, and then no one has any questions. So basically what happened was, if he was here for a month, we were intimate during that time. I mean, even when I'd have little moments of like feeling a little bit better, and we love each other, we wanted to be together. And he felt that, okay, if I didn't get it when you had a viral load of 507,000, now that you're on medication, it's drastically dropping, because we tested it about a week after I started taking medication. It had dropped down to 22,000. Within 3 weeks, it was down to 1,200. I mean, it just drops so fast. The medication, like, I always think of like Pac-Man. It's like when your body's full of it, it just goes around and eats up all the ghosts so fast. And then it's just the last few that are hard to like get. It takes a while to get it down, to undetectable. But the beginning part is amazing. I mean, it just works so quickly. So it's like, it takes a while to get it down, to undetectable. But the beginning part is amazing. I mean, it just works so quickly. So, he left back for Quebec, and he said, when he left, he just said, get better. And I said, and I was much better at that point. And I said, I will. And of course we were in contact, continually through his trip home. He drove back, and we talked all the time. And of course he got home and was able to sit and speak with friends, speak with his mom. And, he knew he loved me. I mean, we were madly in love. This was 1 year into our relationship. This was like a really great relationship. We knew we had something special. And then all of a sudden we have this thrown at us, and it's like, wow. And we already were long distance. So it's like, what do we do with this? But of course I had hope. And then I went to visit him 2.5 months in Quebec after he left. And when I showed up, and he treated me exactly like he always had, I knew that everything was going to be fine with him. So it was, at that point, I had come out public on Facebook, just told people I had pneumonia. And I decided at one point, right after Eric left, and he was okay with it, I said, can I tell people that I have HIV? Are you okay with that? And he said, you could do whatever you feel comfortable doing. And so I did. And then about 5 months later, I said, would you mind if I made a longer version of the story and did it like a YouTube video? Because it's the only way I can upload like a half an hour of me talking. And he was supportive of that. My kids were supportive of it. My family was supportive of it. And that really is the only way I was able to be public about it. Because I know so many people that want to be public about their condition, because hiding it just feeds into the stigma. Everybody wants to be public about it, but they can't for reasons of work or their family or their spouse or their kids. They just can't speak about it because they don't want to put those people in a position of being, judged. And so they can't. And it's so, it's frustrating that have any shame about it. It's a freaking virus. That's it. Yep. But because it's got stigma attached to it, it makes everybody afraid to talk to it, which just, again, feeds into the stigma. It's just, yeah.
Yeah, it's just that lack of education. It was, what you said about how some families, they want to have like separate utensils, or they don't want you to use the toilet or something because maybe they'll catch it after they use the toilet or something. It's ridiculous things like that. But if they were just a little bit more educated on how the virus actually works, as long as you're not sticking needles, with each other,
Yeah.
it shouldn't be a huge deal. And especially with the right treatment, you can live
Hmm.
again a normal life and a healthy sexual life as well too, which is really important for a lot of people, of course.
Totally.
Um,
Yeah. And then go ahead.
I was gonna ask, what kind of small changes do you think? Like, are there anything tiny that you're just like, that's kind of annoying, and not a lot of people would see, or something like that? Annoying, and not a lot of people would see, or something like that.
You know, I'm so optimistic about HIV. You're not going to ever hear me complain about it. I feel like it put me on top of my game. I'm just constantly in my mind. I'm like, I just want to prove everybody wrong. Like, so I'm going to work out harder than I ever did. I'm going to like eat better than I ever did. I'm going to look better than I ever did because I want to show everybody this is what it is today. And so it pushes me to be better than I ever have been, honestly. In my old 49 years, I mean, I'm trying to do my best, but seriously, like I don't want this to ever, I don't want anyone to ever look at me and then think, oh, it's because of HIV. Never. Like that makes me so mad. You have no idea. Because to me, I feel no different. So I want, if I can, to do everything I can to help the stigma. And by doing that, it's just to live as, this way of just proving everybody wrong. That's what I want to do. And so in this position, thankfully, publicly, of being able to help. And so for me, I feel incredibly grateful that this all happened. It's a really, really weird turn of events, but it really has been an amazing change in my life. And I don't, there's nothing about it. I mean, I have a little tiny side effect from my medication. About an hour after I take it, sometimes I'll feel a little queasy, and it fades within literally 5 minutes. And I always know that that's what it is. And I always feel this like strange feeling of comfort because I know it's working, and I'm like, I know it's there. I know I took it. I know it's keeping me healthy, and that's about it. But no, I really don't. This all is because I am public. I have a lot of support. If I had been in another position, if I had been a gay male who'd been rejected from his family, of course, I'd be dealing with so many different issues. And so I'm just, I'm really in a different position than many people who have HIV. I know that. So I'm privileged, obviously, in a way to be, I'm really in a different position than many people who have HIV. I know that. So I'm privileged, obviously, in a way to be where I am with it. So I don't have anything negative to say about it, honestly.
It's amazing. It's so motivating just to hear from you how you'll just fight through this. And nothing's gonna stop you. It's such a
Oh.
heartwarming feeling. It really is. Is there something else that keeps you so grounded and motivated the whole time?
Uh, well, I mean, really, this whole turning into an advocacy and being an advocate is nothing. Well, I mean, I remember laying on the couch and a girlfriend saying to me, "I think you're going to be like educating people about this." And then it did happen. It happened. I mean, I put that video out and it got a lot of views, and it turned into a YouTube channel. And now I became the spokesman for HIV, and it really, yeah, it's incredibly motivating. So, what was the question? Spokesman for HIV, and it really, yeah, it's incredibly motivating. So, what was the question again? I got lost in my train of thought
what
there.
what keeps you so motivated and grounded?
Oh, because I just know I've got people that are counting on me for sure. I've got a slew of people that need to hear from me, that need to see me living my life normally. They follow me on Instagram. I'm very, very, I'm a frequent Instagrammer. I'm Instagram storying my life every day. And so I do that so that people can see this is how normal it is. This is what I do every day. I go to work, I work out, I take care of my kids, I go to parties, I go to the bank, I go to the store, I do these things. This is all what I do, and I'm around people. And guess what? I have HIV. They're all around me. They don't know it. There's no flashing bulb on my head that says I have HIV. Nobody bothers me. Again, work, I've never had one problem at work. And a lot of the kids know, like especially junior high and high school, they're very aware of my channel. There's been an issue of anybody being weird about it. And I heard one time I was doing a PE like lineup and I was doing the attendance and I hear somebody say, yeah, she's got HIV or something. I said, oh, did you have a question? I said, yes, I have HIV. Do you want to know anything about it? I'd be happy to tell you anything you need to know. So, and I really do discuss it with the kids like as if it's the flu. That's kind of how I want them to like see it. Like, I don't have the flu anymore. it's still hidden. I take medication every day that keeps it completely like, dormant. But if I were to stop taking it, then I could get sick again. But I'm fine, So I just try to describe it in those terms. But yeah, the people that follow me keep me incredibly motivated for sure.
So let me ask you this then. When you do tell somebody new that you are HIV positive, what kind of reaction would you want them to have towards you?
Well, I know that when I was HIV negative, which was 45 years of my life, right? I'm not somebody who was born with this. This is all brand new. I was like, I know for sure that if I would have hugged somebody with HIV, I probably would have been proud of myself. Like, I'm glad I gave him that hug. I hope that made him feel good because, maybe he's worried that people won't hug him. And then I'd probably think about it and think, yeah, there's no way I could get it from a hug. I know my mind would think like all these things. So I understand that other people are going to think these things too. And I really do. Like when I go to a party, I think about, I didn't bring it up last night. I actually was at a Halloween party and I decided like, sometimes I know there's some people that already knew, but I don't want to be the spotlight every time I go somewhere and say, yeah, I have HIV and I do this. So I just don't always bring it up. But I do worry about like someone seeing me dip like into the salsa and maybe them being concerned I'm going to double dip, so I never do because I don't want anyone to be worried. But I think like people might think things like that. So yes, I'm really aware. Like if I say something to somebody new, I think, how would I think if somebody told me that? So I'm really aware of people being shocked for sure. And especially if there's somebody older and not like a teenager. And so I just kind of go with their reaction and explain to them, and like, do I need to like hit them with I'm undetectable. I'm not, it doesn't affect me. I'm going to live a long life. I kind of like get a feel for like how much I need to tell them right up front so they don't like, their judgments don't come out right away, if that makes sense. I'm like, kind of like, it's almost like chess. Like how much do I tell them right away? What are like the bullet points that I need to get out right away so they're not like worried? You know what I mean? So there are like specific things that I'll probably say right away. My boyfriend didn't get it. I'm living a normal life. I'm healthy. I like try to go like through all of it so people understand.
Yeah. I totally understand that. It definitely can be shocking for somebody when they hear it for the first time. And just like you were, you said that you don't know anybody else who is HIV positive.
Nobody.
And your story is just so amazing because actually, I never really thought you had AIDS. Right, you technically now you don't have AIDS. You don't fit any of the defining descriptions of diagnosing somebody with AIDS. You're just HIV positive,
right?
And you just got that virus.
Right.
And a lot of people don't know that. They think especially when the Queen movie just came out with Freddie Mercury. They depict how somebody gets HIV positive and then they get AIDS, then they die due to some infection.
Right.
But it's just not like that anymore. It's just we have the right treatment. Right. It's totally manageable, just like you said. And hearing this from you, it's amazing. And I have this big smile on my face. I really do this whole time hearing it from you. So Jennifer, my last question for you would be, for people out there who maybe just recently got diagnosed with HIV, or they know somebody that just got diagnosed and are HIV positive, what kind of advice HIV, or they know somebody that just got diagnosed and are HIV positive, what kind of advice can you give for that person?
And I do have people that contact me with that question quite often. And I basically just said, give yourself time to process this. You are going to be thinking about it nonstop. It's a new adjustment. You have to realize you're now a person living with HIV. Those 3 letters now go with you. And you have to get through that, time where you're thinking about it nonstop. You're wondering if everybody that's looking at you knows that that's what's going on in your body. So there's that process of it just takes time to get through that. And then you start to accept it and you take your medication. I think I have to say for myself, it's a different process because I was getting better from an illness. So it was like this great feeling of like, oh my God, I'm not sick anymore. But there are people that never, ever get sick and they just take medication from the get-go. It's different for them because they never felt sick. So I actually am a little grateful that I had to go through that first. But I think it's just a process, and it takes time just to like psychologically accept the fact that you're now a person living with HIV. You have to go to the doctor more often. You have to think about it's more, I think, stigma that is people are concerned about, like more than the virus itself. I know that I get that a lot with people that follow me. They're more concerned about just how I'm going to tell family, how I'm going to tell a new, potential partner. Disclosure is one of the hardest things to deal with. And I'm not in that boat. I didn't have to go through that. So I know that that's incredibly difficult. So it's just learning how to navigate those new stigmas that you're going to have to deal with, really. But I know that there's a lot of support online. There's a lot of places that you can go online to, talk to other people that have HIV, which is very helpful to not feel alone, because you don't want to feel alone in this. Try to seek as much support as you can so you're not dealing with this all by yourself. And stay on top of your medication. Make sure you take it. A lot of people can go through a downward spiral and they just decide, you know what, forget all this. I'm not even going to take the medication. I'm going to let this take me because I'm so disgusted with myself. I'm so mad at myself that this happened that I don't even want to try. And that some people do go through that and they do end up getting really sick and they have to get to that bottom before they can start coming up. But I, encourage everybody to obviously just take your medication from the beginning and, take it every day and don't go through that. You don't need to. There's no reason to. It's more just, getting the psychological help if you never get sick and just to try to accept the fact that now you're just somebody living with it. And if I can please say something about U equals U, because it's incredibly important and everybody should know that people living with HIV, now when they become undetectable, which they say safely it happens within 6 months, it can have people living with HIV. Now, when they become undetectable, which they say safely it happens within 6 months, it can happen within, honestly, 2 months. And mine happened within around 2 months. Anything under 200 for U equals U is considered undetectable. So a person living with HIV who is undetectable, they can no longer transmit the virus sexually to a sexual partner. And that's any kind of sex, anal sex, vaginal sex, oral sex, which we don't really think it happens like that too much anyways. But it's not transmittable at all when somebody is undetectable. They're on their medication. And it's U equals U, undetectable equals untransmittable. And if people want more information about that, they should go to www.preventionaccess.org and just read up about it. Everyone's talking about it. We're really happy about it. It's very, very important that people living with HIV know this, because a lot of people living with HIV still don't know this. And they're living in this bubble of thinking they're going to transmit it to their partners, and they just need to know. So it's great for their health. It's great for their years. It was meant mostly just for people to have better health, to be undetectable. But the caveat is that they also can't transmit it. So it's amazing.
That sounds all absolutely amazing. And that was great that you mentioned the U equals U. I'll put the website in the show notes. And you also have your own YouTube channel. Do you want to tell people where they could find you so they could see your story a little bit more in depth?
Yeah, a really easy way to find me is just put in Jennifer HIV and you'll find my channel. It's Jennifer. It's just my name. It's Jennifer Vaughn, Vaughan. And all my videos are there. And I also do Instagram. My Instagram is VaughnGirl24. It's VONGIRL 24. And it's public, so you can just hop on there and follow my Instagram story every day and see all this crazy, stupid stuff I do. And and the more the merrier, for sure. And share it. I want people to see what this is today and, how normal it is and what a normal life you can have, for sure.
Jennifer, I'd like to thank you so much. I think it's going to really help a lot of people out there who, it doesn't even have to be somebody who is HIV positive, but for people who just don't know enough about HIV, and this will definitely increase a lot of knowledge and awareness to HIV positive. Thank you so much. I really appreciate you being on the show today.
Thanks for having me. Appreciate it.
I really appreciate it. This was great. Thank you so much.
Awesome.
And
all right, Robert.
Take care. I hope you.
Yeah, let me know when it's up. I want to hear it.
Absolutely, I will do. Will do. Thank you so much. I'll keep you updated when this gets up, and just keep going with everything you're doing.
Thanks, Robert. I appreciate it. Have a good one.
You too. Take care.
Okay.
Bye.
All right. Bye.
Just a quick note after the interview. I hope you enjoyed it. But please, 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 most important thing out of all this is just get tested. Whether I was in Poland, in Scotland, or in the United States, it's extremely easy to go and check if you are HIV positive or not. It's just a simple blood test, and it really means a lot just for you to know, because some people might not know. Some people think that it's impossible for them to get it. They think they're immortal and there's no way they can get sick with HIV. And just like I said earlier in the podcast, there's this asymptomatic phase where you just don't know. Maybe you just had the flu and you thought it was a cold or mono or the flu, and you just kind of shrugged it off and as nothing. And then there's this 4 to 7 year period of being asymptomatic, and you just wouldn't even know it. It's so important just to get tested. Um, Education, counseling, and behavior modification, along with the consistent and correct use of condoms in risk situations, remain the cornerstones of HIV prevention efforts. And also just avoid sharing needles, and and just don't try not to share needles. If you are a drug user, an IV drug user, at least just use a clean, sterile needle if you need to. But also, not promoting it. Better if you don't. If you liked this episode, please leave a review and a comment. And if you didn't like this episode, well,